Good evening, Madam Chairman and members of the Senate Judiciary Committee. My name is Dr. Guam Gday, and I also work at Women and Infants Hospital. Thank you for this opportunity to present testimony in opposition of Bills 2585 and 2709, also known as a dismemberment and partial abortion bills. I am also here speaking on behalf of the American College of Obstetricians and Gynecologists, or ACOG. The Rhode Island section of ACOG represents over 140 physicians and partners who are committed to the safe, evidence-based healthcare of women in our state. I am alarmed to see that these bills are in an attempt to prohibit women from accessing safe healthcare in the state of Rhode Island. These bills would create an unsafe environment for patients by preventing their physicians from having every option available when providing care. This bill would place physicians in the unconscionable position of having to deny a woman an evidence-based treatment with the fewest complications. It is dangerous for legislators to presume that they are better equipped than experienced physicians to judge what treatment approach is appropriate for every patient in every circumstance. Most second trimester pregnancy terminations are performed for fetal anomalies or for the health of the mother. Fetal development is a complex process that can tragically go awry. In the case of some severe birth defects, there is no medical treatment that can save the baby's life. For example, there's a condition where the fetus's brain fails to completely form. These bills do not exclude exceptions for these situations, in effect forcing a woman to carry her pregnancy and deliver a baby with no hope of survival. These medical decisions should be made by each individual woman in consultation with her family and medical providers. If her decision is to end the pregnancy, her OBGYN needs to be able to best offer her the best, safest procedure. This includes the dilation and evacuation procedure, or D&E. As physicians, we are trained to assess the needs of our patients, consider all treatment options, and select the most appropriate procedure for each situation. We have the medical knowledge and expertise to perform these procedures when necessary and know when other options are indicated. Banning specific types of abortion procedures would leave physicians unable to provide medically appropriate care, and this is unjust. ACOG's statement of policy on legislative interference states that laws should not interfere with the ability of the physician to determine appropriate treatment options for patients. ACOG strongly opposes any governmental interference that threatens communication between patients and their physicians or causes a physician to compromise his or her medical judgment about what information or treatment is in the best interest of the patient. When I enter the operating room to perform a hysterectomy, and that's a procedure where the uterus is removed, I determine the type of incision to make based on multiple clinical factors. To allow for a successful operation, it is necessary that I make this decision without any interference. You trust that I have enough clinical training and expertise to determine how I approach a hysterectomy, which is why there are not laws about hysterectomy technique. Determining the technique used in performing an abortion should be no different. We all deserve to enter our doctor's office confident that the care we receive will be based on solid scientific research and experience, and not based on a political mandate from the State House. Just like you want your doctor to have access to all the best scientifically proven treatments for you and your family, I want the same for myself and for my patients. I recognize that the issue of abortion is both politically and emotionally charged, yet that just does not justify the unwise and unsafe political intrusion into the practice of medicine. On behalf of ACOG, I urge the Senate Judiciary Committee to reject bills 2585 and 2709. Thank you again for the opportunity to testify.